All right. It came to our knowledge that you have difficulty in walking for the last 2 months. Please tell me more.
Yes, doctor, it started gradually, and for the last 2 months, I can't walk properly, and it's intolerable for me to accept it that I can't walk properly, that I have to do the work, I have to do the sports, I have to do the gym, I can't do anything for the last 2 weeks. It's severely increasing.
Mm. I'm sorry for what you have been through. And it started the first time 2 months ago.
Yes, doctor.
And from what you told me, I think it is worsening.
Yes, doctor.
And any is it one leg or both legs?
Both leg, doctor.
Okay. And all right. And since it started, do you feel it is in your lower legs or even in your thighs?
It's all over the leg, doctor. There's nothing that I can say is this part or anything specifically. Is all over the leg. I always feel pain when I try to walk.
All right. Okay. And did you have any trauma to your back before that?
No, doctor, no trauma.
Okay. And any tingling or numbness?
I didn't notice, doctor.
Okay. And did you have any problem in your arms as well?
You are asking for the pain?
Yes, the pain.
No, doctor.
And did you notice that your arm, like holding stuff, is weaker or no change?
Actually, I feel tired, but I didn't notice any weakness in my arm.
Okay. And you feel tired all the day, or it's more at the end of the day?
No, doctor, all over the day.
Okay. Any problem with your speech?
No, doctor.
Okay. Any headache?
Doctor, you are right. I have headache.
And tell me more about the headache. Where exactly in your head?
All over my head, doctor.
And how does it look like?
It's like a band, like doctor.
Band. Okay. And is this headache increase specifically in the morning?
No, doctor.
Is this headache increased by coughing or sneezing?
No, doctor.
All right. Okay. Any problem with your eyes or blaring?
No, doctor. I didn't notice.
All right. Okay. And did you feel dizzy?
Yes, doctor. I occasionally feel dizzy.
Mhm. Is this dizziness specifically when you stand from sitting or not related?
No, not related, doctor.
Okay. And any fits or seizures?
You are asking for shaking? No.
Yeah. Okay. And all right. And okay. And do you have any high temperature?
I didn't notice, doctor.
All right. Any change in your weight?
I didn't notice any weight changes nowadays.
Okay. And any lumps or bumps in your body?
No, doctor.
Okay. And did you have any back pain?
In my back, I don't have any pain specifically, apart from my leg.
Yeah. And any pain in other joints of your body?
I have pain on my elbow, on my wrist.
Mm. And did it start all at the same time?
I didn't notice any timing. It's on and off.
Yeah. And do you have any jaw pain?
Jaw pain? No.
No. Any stiffness in the joint?
No, doctor.
Okay. Did you notice any pain in your muscle pain?
No, doctor.
Okay. Do you have difficulty combing your hair or getting up from the chair?
No, doctor.
All right, okay. And did you notice any skin rash?
No, doctor.
Okay. And all right, okay. And any mouth sore?
No, doctor.
All right. Any chest pain?
No, doctor.
Did you notice any cough?
No,
Any you feel your heart beat fast? Any heart racing?
no. I don't have any racing of the heartbeat, doctor.
Okay. And do you have any previous medical condition I should be aware of?
I have high blood pressure and it's not controlled yet.
You have high blood pressure and it's not controlled. Sorry, I missed the last word.
Yes, it's not controlled, doctor.
Since when you have high blood pressure?
It's the last 2 years.
Last 2 years. And do you know what was your last blood pressure reading?
140/100.
And do you know why it's what medication do you take for it?
I'm taking listener pill, 20 milligram.
Okay. And it still is not controlled.
It's not controlled.
Okay. And are you compliant with your medication?
Yes, I am.
Okay, all right. And apart from high blood pressure, do you have any other medical condition?
No, doctor.
And okay, all right. And uh, do you take any medication apart from lisinopril?
No, doctor.
Okay. And do you have any family history of difficulty walking?
No.
And any family history of any problems?
My father has a heart attack and my mother has rheumatoid arthritis.
All right. Okay. And Mr. David, what do you do for a living?
Actually, I'm a gym worker,
You are what, sorry?
gym trainer in
Gym
a
trainer.
gym.
Okay.
Yeah.
Yeah, okay. And what do you do? How do you smoke?
Yes.
And how many cigarettes do you smoke and for how many years?
20 cigarettes for last 5 years.
Smoking generally harm your health. I would like to advise you to stop smoking.
I'll think about it, doctor.
Yeah, I can refer you to smoke cessation clinic if you want.
I'll think about it.
All right, okay. And how about drinking alcohol? How much you drink in the week?
It's within normal limit.
Okay. And with whom do you live at home?
With my girlfriend.
Okay. And how this is impacting on your job and your daily activity?
Doctor, last 2 weeks and I am as gym trainer. I can't do any work for last 2 days. Even I can't join anything. I can't do anything. Even I'm taking painkiller for relieving my pain, but it's not relieving.
Oh, sorry for what you have been through. We'll try to know what's causing it so to help you.
Thank you,
Um,
doctor.
just more few questions. How is your mood, Mr. David?
My mood is good, doctor.
Any stress in your life?
No,
Okay. Um, all right. I would like to examine you now. Is that okay?
thank you. No problem.
All right. I would like to know the blood pressure now.
So you are checking blood pressure. So in the blood pressure reading, now in the right hand, as if you will start the measurement, it's a 140/100.
140 by 100. Okay. And I would like to start examining the lower limb. I will
What you want to check, doctor, in the lower limb?
yes, I would like to look any wheelchair beside the patient and looking for any reticulation, any scar, anything in the lower limb by inspection. Then I will
Okay.
start by
So
the
you are inspecting. On
Okay.
inspection, there is no scar mark, there is no wheelchair in observation. Anything else?
Any vesiculation?
No, no
Any
fasciculation,
any deformity
no
or
deformity present,
any base cavus, any clawing of
no
the toe?
pescavus, no claw.
Okay, and then I will start by tone.
Tone you are checking. You started from the right side and the tone is normal.
In both under and the left side.
Normal bilaterally.
Okay, normal tone. And power.
Power you are checking and bilateral power is not remarkable, it's normal.
Okay, and I would like to check for reflexes.
Okay, you started the checking the reflex and bilaterally knee and ankle, the bilateral is normal.
Okay, I would like to do coordination. We'll ask the patient heel, knee, chin.
Heel and shin chest you started and it's bilaterally unremarkable.
Okay, I will do pinprick sensation and vibration.
So it started pinprick sensation from the grade 2 and it is not any can changes. It's a normal.
Okay, and vibration.
Vibration intake, pinprick sensation intake.
Okay, all right. I will ask the patient if he can walk for me, looking for the gate.
Patient can walk and patient telling, ma'am, I have a pain when I try to walk.
Can he point where the pain?
Patient telling it is all over my leg bilaterally. There's no specific area that is painful.
Okay, and all right. If the patient can sit in the chair, can he stand up from the chair without holding?
Yes, can. He can.
Okay. I would like to check pale and jaundice.
There's no pallor, no jaundice.
I would
2
like
minutes
to,
left.
okay, examine for visual acuity.
Visual acuity you are checking and it's normal.
And I would like to offer fundoscopy.
You are offering the fundoscopy and examiner telling no need to do it right now.
Okay, all right. I would like to, he said he have wrist and elbow. I would like to examine the wrist and elbow. Any deformity, any skin finding.
So in observation, there's no deformity. If you want to move in the wrist and elbow, you are seeing he can do move, but there's some pain during movement.
Okay, all right. Mr. David, this question, did you take any previous? I know you don't take a medication now. Did you take any medication previously?
No.
No. Okay. So what's your concern, Mr. David?
Doctor, do you think that is any serious issue I should know or I have to admit right now?
Okay. From what you told me, and after I examine you, I'm expecting you may have a condition called fibromyalgia,
Okay.
which is causing the pain.
Okay. Your
But
time is up and
okay.
I'm giving you 1 minute for recap and I'll start the examiner question.
Okay. So can I continue then now? Yeah.
1
Go
minute you can recap
Okay.
or you want to start right now. Can you summarize yourself? Do you need time or I'll start the examiner question? What do you think?
Yeah.
Okay, and 30
I want 1
seconds.
minute. Yeah.
Okay, 30. Okay.
Thank you.
Dr. Suha, your time is up. Just examiner question.
Okay.
So, doctor, could you tell me on your history, what are the positive findings? you did get in your point?
Yes, so this is 35 years old male, complain of difficulty of walking over 2 months. It's painful. It started gradually on both legs. He also have headache all over his head, band-like headache, and sometimes he have dizziness. He have elbow and wrist pain as well, and he's known to have high blood pressure, hypertension for 2 years. On lisinopril 20 milligram, the blood pressure is still not controlled. He's non-smoker, and he's a gym trainer. That's it in the history.
Did you get any point in favor of your examination?
Sorry, what? Did I what? Sorry?
Any point that you get in your examination?
Okay. In examination, apart from pain in the lower limb, generalized pain in the lower limb, and in the wrist and elbow, apart from that, I couldn't appreciate any other abnormalities and high blood pressure.
Did you offer pulse checking or did you check pulse?
No.
Okay. So, doctor, so on your finding, what you differential or you have diagnosis?
I would say differential.
You have differential or specific diagnosis, doctor?
Differential.
Okay. Can you tell me your differential list?
Okay. It could be fibromyalgia, could be chronic fatigue syndrome, and what else? Could be complication of hypertension.
So if you think, doctor, complication of hypertension and uncontrolled hypertension for the last 2 years, and still the finding is 140 over 100, do you have any differential in favor of that?
Okay. Could be secondary cause of hypertension.
So what would be the diagnosis if secondary cause of the hypertension, which the disease caused the leg pain, uncontrolled hypertension? What is the name of this disease?
Is it Cohn's syndrome?
Cohn's
I'm not
syndrome
sure.
is it not causes any leg pain? Leg pain, why, doctor?
Because of hypokalemia.
There is no hypokalemia feature, and hypokalemia more cause weakness. Hypokalemic periodic paralysis, but patient frequently telling, ma'am, I have a pain, I can't work. Still now, if I started work in front of you, ma'am, I have to sit right now. So if your patient telling, ma'am, I can start working, but can I sit now to rest? And I feel good when I take rest. What is the disease name?
Is it Takayasu arthritis? Could be intermittent claudication.
Apart from this, any differential on favor of my description, what I said right now?
No.
Peripheral vascular disease or Burgess disease. Could be claudication, right? Okay. So, doctor, uncontrolled hypertension, and if you check the pulse, if I say right-sided pulse is not detectable and brachial pulse is not detectable, what you want to put in your list in first?
I will put Takayasu
In
arthritis.
second?
Because
second?
of the Takayasu arthritis.
Second, yes, it's a first. Second, doctor? Second differential. First Takayasu, second differential.
Second, sorry. Second differential will be still Berger disease. And
Berger disease. Yes.
Yeah,
Third,
coarctation of the aorta.
atherosclerosis,
Yeah.
right? And coarctation of aorta. And if you check the carotid bruit, if I say carotid bruit present, so what will be the most appropriate in my list?
It will still be beta keratoarthritis.
Okay. And if I, so on examination, what examination finding you have to add or you have to offer?
Okay, I would if I have to offer more, I will do pulse cardiovascular examination. I will do
Cardiovascular.
carotid bruit, brachial bruit,
Okay.
renal bruit.
Okay.
I will check
Excellent.
blood pressure on both hands.
Excellent. And it's
I will check right
asymmetrical.
femoral drain.
Excellent.
If
So asymmetrical blood pressure, I said right-sided blood pressure, 140, 100. I given you clue. You have to offer what about the left side? Mean the examiner trying to giving clue the right-sided blood pressure. This word very important. So time is up, doctor. Thank you. Now the evaluation. Okay. Your yeah. First, before your marking, I want to tell when I said difficulty of walking and you start your taking the history, the pain. I said that last 2 months it started gradually. Now it worsening, ma'am. Now it worsening, ma'am. So two questions very important. What do you mean by worsening? So I have to tell, ma'am, when I start walking, after 10 to 15 steps later, I have to sit down or I have to sit up. Mean it's a claudication. So it's ischemia. So this very important. You already asked very nice question. Is it sudden? Is it gradually? Is it increasing? Is it a same? So I said it's increasing. I can't do proper work. I'm a gymnasian. I thought that my gymnastic work is worsening my activity, but you said you didn't ask any question that you completely you can't work or you can work. I say that if you ask this way, I can tell I can't do any work. If I do work, the pain worsening. Dr. Suha, are you getting my point? You already told me the pain. What type of the pain? It is all over the limb. I said yes, it's all over the limb. This is ischemic pain over the leg, Dr. Suha. So you have to tell, if I say 0 is minimum, 10 is maximum, what will be your grade? So I tell now it's a 7 to 8. Before it was 5 to 6. Your history taking, nice. You also asked me association, tingling, numbness, weakness. Always I teach all the candidates who are taking my course that a concise way ask the history. If you think it could be any kind of the weakness, nerve issue, ask those questions completely. Is it this pain due to the ischemic or claudication? Ask those questions. Specific question. So specific way. If you list, always ask question group of list. My first differential, Takayasu. Second, peripheral vascular disease, atherosclerosis. So question should ask group wise. If it is temporal arteritis, you ask me, do you have a headache, passion problem, jaw pain? I always say, yes, okay, fine, you can keep it in your differential, but age is the issue. Their age is 35. Always Takayasu start after 50 or 55 later. So better keep it later. First up is the peripheral vascular disease or atherosclerosis, or you can ask the thromboembolism, thrombotic. You ask those questions, any tachycardia, any chest pain, any difficulty of breathing, any kind of the blood thinning medication, specific group question, very important. Takayasu arteritis constitutional symptoms, headache, joint pain. I said that Takayasu is a vasculitis, inflammation of the vessels. So any kind of the joint, arthralgia, body temperature, all clue, all information they will not tell you, like weight loss, high temperature. There's a two very important, like if I keep peripheral vascular disease initially, okay, but my finding was there's a carotid bruit, there is a absent pulse. So tachycardia first, then peripheral vascular disease could be due to uncontrolled blood pressure or atherosclerosis. Drug history asked nicely, any illicit drugs. It's a personal question, but I'm asking to reach my diagnosis, any kind of the illicit drugs, any allergy history, what apart from the lisinopril, any kind of the drug I should aware of that. Past medical history, apart from high blood pressure, any need of the admission, any blood transfusion, any surgery, because you don't know where you have any information. So in details, your job history and affecting, offering the help, occupational health worker, social support. I said already that I can't do anything because due to my changes of my difficulty of everyday life. You should check the limb examination. The power, tone you already did, but the changes of the color, skin changes, peripheral, very important. They'll give you 0, I mean unsatisfactory. If you don't check the peripheral pulse, okay? Arteria dorsalis pedis, and you have to check the changes about the whatever the disease, any loss of the disease, nail changes, all the tibial pulse, dorsalis pedis pulse, you have to check those pulse, very important. And you miss those pericardium, you miss the radial artery, okay? So this is the very important to evaluation. Dr. Suha, are you getting my point? You have to offer the fundoscopy for any kind of the retinal ischemia, and blood pressure and control, I already told, and CVS examination, any kind of the aortic regurgitation. If you examine, I will give you the some clue, okay? Even you are not getting the any kind of the diastolic murmur, but I tell you there is a murmur. So there is a correlation. Concern, I always tell safety. I mean, I have to take full mark actually. Concern is the point that I have to carry maximum mark. But even if you not understand that what could be possibility, I said, is it any serious? Do I need admission? You can say actually, after taking your history, if you are not sure that what could be, that I will make multidisciplinary team. I have to do some investigation. I have to run some blood tests, and after taking or reaching those test results, I'll feedback to you this way. But no need to tell that if you're not sure about that, like fibromyalgia, chronic fatigue syndrome, because I didn't tell any kind of mood issue, I didn't tell any kind of the stress, any kind of the triggering factor. Even chronic fatigue syndrome or fibromyalgia, mainly there's a differential point of the lymphadenopathy, any kind of the risk, so they'll differentiate it. But when difficulty of walking is a claudication in nature, so very important to search the us first vitals, pulse. If you start checking the pulse, there is a no pulse. What about the breathe? What about the my pericardium? So there is a lots of finding, Dr. Soha. So in details, the clinical communication skill I am giving borderline, as you have to ask the conscious question, and the physical examination not satisfactory, clinical adjustment. Even I just try to help you to reach your diagnosis. That's why investigation management, I didn't get those point in search, because you are not still not on the diagnosis point. That's why unsatisfactory, and concern is still unsatisfactory. So all over, this is your marking distribution. Any question from Dr. Suha, that what makes you the chronic fatigue syndrome and fibromyalgia? I want to get feedback from Dr. Suha.
I think because I didn't know what is the cause and I forgot about hypertension. I missed it while the aim to reach my diagnosis. But yes, you are
I
right. There
mean,
is no mood change or anything.
yeah, but when your evaluation, just important one point, when started that walking history regarding the claudication, like chest pain, is it exertional chest pain or inspiration? I should differentiate ischemic or not, right, Dr. Suha? So here
Okay.
there's a walking difficulty. Is it ischemic or not? I mean, is it inflammatory or it's mechanical? I mean, joint pain. Mechanical mean it's arthritis and a trauma. If it is inflammatory, I understand it's RA, SLA, but here it's a walking difficulty. Is ischemic claudication or not? I have to fix it up. Do you have this walking difficulty during walking? Yes. During how much you can walk? It's around 5 minutes or 10 minutes. Then I have to sit down. Mean it's a claudication. Whatever. Down, just start checking the pulse from the leg, Dr. Suha. Right? So first, you have to reach my diagnosis. Is it claudication or not, right? Then my pulse, very vital, leg pulse, arm pulse, upper limb, lower limb, right? Even if you forget to do the tone power, if there's no problem. Here mark is the pulse, precordium, carotid and fundus offering. If this scenario 3 to 4 week came, many center in this 23, 24, when it's still ongoing, either dizziness, either visual disturbance, either claudication pain, lots of matter, lots of way. So each and every matter, so the differential mark, the judgmental issue, CT angiography, ASR for the inflammation, right, Dr. Suha? There's a lots of issue you have to ask and you have to do. CT scanning, MR angiography, CT tomography, right, Dr. Suha? Ultrasonography, PAT scanning. So every important imaging study, inflammatory study, autoantibody, batches question you ask for the thrombotic risk. It could be embolic, it could be thrombus, but apart from batches, others as well. So for my LCC, for get full mark in my clinical judgment, in case of the examination, in investigation, I have to be very specific. What I am telling, what I am getting. I am telling all are the inflammatory and the vasculitis. If you tell the chronic fatigue syndrome, the mark will be so low. So what the surrogate telling, very important to catch those information. Clear, Dr. Soha? Any question from anyone?
Yes, clear.
So
Thank you.
thank you, Dr. Soha. So Takayasu arteritis, very important. This came dizziness as there is a bilateral, it's a symmetrical blood pressure differential, pulse absent, there's a carotid buoy. So this way dizziness. So Dr. Suha nicely asked, do you have feel dizzy sitting distance? I said no, mean it's not neuropathy. If you ask the bundle question or group question, do you have high blood sugar? I said no, mean it's not diabetic complication. Addisons, okay, ask the adrenal insufficiency. Why dizziness? If the same scenario doctors come as a dizziness, if you think, okay, it could be endocrinology, ask those questions first. But still you're not reaching your diagnosis. There's no adrenal insufficiency, there's no diabetic neuropathy. So what else? Check the pulse. If pulse disturbance, even in real patient, there's no pulse. In bilateral, it's true. It's true there is a bilateral pulse absent. No brachial pulse, no radial pulse. Check the carotid buoy. Even maximum 70 to 80% case, the carotid buoy normal. There's no buoy. But pulse, or eventually, even if surrogate, they'll tell you no need to check the pulse. Pulse is absent. Mean this is surrogate, but they're giving it's absent. So even they are not surrogate, this true patient, it's a peripheral vascular disease. There's pulse present. There's no carotid buoy. There's actually asked, is there claw hand? Is there any kind of spastic? Is a floppy? Is any kind of the spastic paralysis? Nice way. But I say no, no, no. So I have to walk another road, not this road. It's another case. Because spastic paralysis, floppy paralysis, obviously if patient told, I don't know, do the examination. In examination, there is a finding. Because obviously in true patient, there will be finding. But if there's no finding, go to the arterial cause, inflammatory cause. Okay. Then here very important to remember the differential and the investigation. If it is a peripheral vascular disease, Takayasu arteritis, in Takayasu arteritis, ESR, color Doppler ultrasonography, and CT scanning, MR angiography, very important biopsy for the arterial inflammation and the differential according to your finding. Like in my case, in this case, first it was Takayasu, second was the peripheral vascular disease, third was atherosclerosis, and fourth was coarctation of aorta. This was this scenario. Examiner question in real exam was the what are the criteria to reach the diagnosis. So the obligatory and major criteria: age below 40 years, there's a left mid subclavicular lesion or right mid class subclavicular. This is the questions. In minor criteria, cardiac tenderness, hypertension, high ASR, aortic regurgitation, pulmonary artery lesion. This just asking that as there's a time for the crossing or examiner question. So these are the Takayasu artery examining or the question what we can face in our real exam. Any question from anyone? Any question from anyone from this scenario?
Doctor, do you record this or no?
I didn't understand, sorry.
Did you record this session? Because I am not attending only just.
Okay. So recording. I'll try my best because initially my candidates was facing difficulty to restart the session because network issue. If we solve this issue, it's my full recorded the session. I'll upload on the YouTube. No problem. Thank you.
Thank you.
Thank you. Thank you so much, Dr. Suha. Hoping and all the candidates take strong study, take bedside practice, take more study practice, history taking, investigation, management, very fluent. Okay, thank you so much. I'm ending my session. Assalamu alaikum to all.
Thank you.
Thank you.